After 54 years of public service, Dr. Anthony Fauci is set to retire. He started his career at the National Institute of Allergy and Infectious Diseases as a clinical associate and eventually became the director. He now serves as the president's chief medical advisor. Dr. Fauci, welcome to the program.
Thank you. Good to be with you.
You know, I want to start with the early part of your career, which was focused on HIV/AIDS research, and it's something that you continue to study. How did the HIV/AIDS epidemic shape your career?
Well, it was really the major pillar of my career, both from my own personal research, which I have now been studying for 41 plus years, from the very first weeks and months that we recognized we were dealing with a new disease. I was involved in another area of research, and as soon as I heard about and then finally took care of the first group of individuals in the fall of 1981 and have been doing so ever since, I completely changed the direction of my career to focus intensively on, at the time, this new mysterious disease that didn't have a name yet. We were calling it gay-related immunodeficiency, a completely inappropriate name. And we had no etiology agent of it yet, because that wasn't discovered till 1983, 1984. And that really started me on the road of not only my scientific pursuit of emerging infectious diseases, but a few years later, I took over as the director of the Institute in 1984, as you mentioned. And I made it a major effort to put together an AIDS program where we not only did research intensively on AIDS, but we funded investigators throughout many, many medical centers throughout the country and even the world, which ultimately led to the development of drugs, which actually turned out to be life-saving drugs and turned around the clinical course of HIV/AIDS. And that really has permeated my entire career.
And speaking of funding, you are one of the principal architects of PEPFAR, which is the President's Emergency Plan for AIDS Relief. That was established in 2003. What measurable impact do you think that ultimately had?
Well, PEPFAR is, I think, without anybody arguing with this because it's so clear, clearly one of the, if not the most transforming and impactful global health program ever initiated by any country, including the United States. Because what it did, and as you mentioned, President George W. Bush gave me the great honor of tasking me with putting together with others this program, which ultimately delivered care, treatment, and prevention for HIV in the developing world, particularly Southern Africa, who were suffering terribly at a time when we in the developed world had drugs that were life-saving and turned around completely the clinical course of AIDS, where people could lead an essentially normal life if put on therapy. They didn't have that in the developing world. And President Bush felt very strongly, George W. Bush, that we had a moral responsibility to help people under those circumstances. And we put together the program. And since 2003, when we started it, it has clearly saved between 18 and 20 million lives. So that is unprecedented in any global health program that we put together.
And there is a plan to end HIV in the United States by 2030. Do you think that will happen?
You know, that is difficult to say. It is not yet at the pace that we want it to be. The plan was to decrease the number of new cases by 75% in 5 years and by 90% in 10 years. And the program was started in 2020. So we would hope by 2030 we could end it as a pandemic. We're not going to eradicate or eliminate HIV. Just the nature of the infection tells us that's not going to happen. However, we could get it down to a very, very low level. One of the big stumbling blocks against this is that we don't yet have a vaccine, but we can likely get to the level we want by getting people treated who are infected, testing them early, getting them on therapy, and doing what we call pre-exposure prophylaxis, because we have remarkably effective drugs that if given intermittently, we now can do it every couple of months and hopefully every 6 months, to give it to an uninfected person to prevent them from getting infected. And if a person is already infected, you can treat them with very effective drugs to get the level of virus so low that it would be essentially impossible for them to transmit it to anyone else. So even in the absence of a vaccine, our goal of ending it as a pandemic as we know it, we can do that if we continue to push and put resources into that.
Well, let's talk about that other virus, which is COVID-19. How did you first hear about that virus, and what was your reaction?
Well, it was the last day of 2019 and the first couple of days of 2020 when I heard inklings of stories. I discussed this with the then CDC director, that he had heard from his colleagues in China that there was an unusual pneumonia that was seen in some individuals, which at first was thought to be a virus that did not transmit easily from person to person, but was a virus that jumped species from an animal host to the human. And then as the weeks started to roll out from the early part of January, it became clear that we were dealing with a formidable situation with a virus that was highly transmissible, and it was clearly stimulating the Chinese to do things like build in essentially a week 1,000-bed hospitals. And then we knew we were in real trouble. And then by the time we had the initial cases here, it became clear that this was going to be a pandemic because, as you know, the first cases that were seen, we were not quite sure how well the virus was transmitting until we ultimately found out that even people without symptoms were transmitting the virus, which made it very, very difficult to trace that because there was a lot of infection undetected in the community. And when we finally found out about that with the explosion of cases in multiple parts of the country, but particularly early on in New York, that got hit very, very badly, we knew we were in trouble. So it was in the very first weeks of January into February and March of 2020.
All right, Dr. Fauci, quick pause here, and then we'll be back after the break. Welcome back. We're back with our conversation with Dr. Anthony Fauci. Dr. Fauci, Operation Warp Speed was the government program that developed the COVID-19 vaccines in record time. Will the government be able to do that again next time? Is that the new standard for developing new vaccines?
Well, it's going to be part of the standard. One of the things that was highly successful in our ability to get a vaccine out in less than a year that was both safe and highly effective was the investment that was made in basic and clinical biomedical research for decades before COVID came, so that we were able to move quickly with new vaccine platforms and new ways of developing vaccines. But you're quite correct that Operation Warp Speed, which was an enormous investment in money to be able to get pharmaceutical companies to de-risk their process, namely to guarantee that we would manufacture and make available vaccine even before we proved that it was safe and effective, which is very risky in a business model, but it was necessary because it dramatically diminished the amount of time it took to get vaccine to people. We will have a similar model if we get another pandemic, which we will. We don't know when that will happen. It could happen next year, 10 years from now, or 50 years from now. But we have to be perpetually prepared, both from a scientific standpoint and from an implementation standpoint. And Operation Warp Speed was a major historic success from an implementation standpoint.
You know, Dr. Fauci, I don't need to tell you that you became a hero to one segment of the population you were vilified by another segment. So how did you deal with that personally?
Well, what you do is what I have been doing and continue to do to this day, is to focus very intensively on your job and your mission. And my job and my mission is to use our scientific capabilities to safeguard the health and the safety and the welfare of the American public. And since this country is a global leader, indirectly, we do that for the world. So I don't get impressed by the idolization of me, and I'm not intimidated by the villainization of me. I focus on what my job is. I know what my job is, and I do it, and I don't get distracted by those other things.
A major source of frustration for a lot of people was the changes and sometimes contradictions in coronavirus guidance. It led to some distrust in public health officials. How do you build that back, and is there something you would have done differently?
Well, you talk about what was called changes in guidelines because the evolution of the virus was changing right in front of us. And what we need to do better is to get people to understand that science, by definition, is self-correcting. What you do in 1 month when you have data and evidence in front of you is to act on the information you have. When you're dealing with a moving target, like the evolution of an unprecedented pandemic, things change from week to week and month to month. And if you're perfectly honest with yourself and others, you will make changes in interpretation of what's going on, and changes in associated guidelines and recommendations. And that's what happened. It was merely science getting information that was unfolding in real time in front of us. And understandably, some people may think that's flip-flopping or changing your mind without a good basis. No, it was actually following the science. So we very likely have to do a better job of getting people to understand that it isn't like mathematics when you're dealing, where 2 + 2 = 4 in January, in April, and in August. No matter how you look at it, 2 + 2 will always equal 4. But when you're dealing with an evolution of an outbreak where things are changing before your very eyes, then you have to realize that things will change, including recommendations and guidelines.
And Dr. Fauci, I want to ask you a personal question, which is, why did you choose public service? You could have been a doctor in private practice, you would have made more money, and you would not have had to deal with all the headache.
Well, I chose it because I feel very strongly, at least for myself personally, I feel almost an obligation to serve the public. I've learned that from the time I was a child with my parents. I went to an educational institution as a high school student under the Jesuit priests, and at a college with a Jesuit education, where the theme was always service to others, not making money, not self-aggrandizing, but serving others. And I grew up with that, and I feel very strongly with that. And I've done that for my entire professional career. And material things like making a lot of money in a practice, not that there's anything wrong with that, that just doesn't appeal to me. What appeals to me is doing things that you know are helping society.
So what are you going to do in retirement, Dr. Fauci?
Well, I'm going to continue along that line, only outside of the confines of the government. I would hope that I would be utilizing my 54 years of experience as a scientist in the government, my 38 years of experience of running a major infectious disease institution, and the privilege I've had over that time of advising 7 presidents of the United States. And I would hope that that experience would be beneficial to people, either in an advisory capacity or, even more importantly, to perhaps inspire younger people to get involved in science and to get involved in what you mentioned, namely public service. If I can do that, I think that would be able to help the younger generation to realize why it's so important to continue to serve the public.
All right. Well, Dr. Fauci, that's all the time that we've got. Thank you so much, and Thank you for your 54 years of public service.
Thank you. It's good to be with you. Thank you for having me.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.